Good afternoon, I'm Vashon Brown with the Midday News. A special welcome if you're watching on onespotmedia.com. Following a Sunday Gleaner expose which revealed that only 4 of all the privately run hospitals across the island are registered by the Health Ministry, the government says steps will be taken to address the matter. O'Shane Masters has more.
Concerns are being raised by members of society on how numerous privately run hospitals are being able to care for the sick while not being registered. This came to the fore following a Sunday newspaper article titled "Hospitals in Breach: Embattled Angels Among Private Facilities Operating Without Government Certification." The article was spurred on following the death of 23-year-old Jodian Ferron, who was refused treatment at 2 hospitals after developing symptoms similar to that of COVID-19. It must be noted that local private hospitals are governed under the Nursing Homes Registration Act, NHRA of 1934, which is separate from the National Health Services Act, which regulates public hospitals. Speaking at a press briefing yesterday, Health Minister Dr. Christopher Tufton said that measures are being looked at to improve registration.
We have seen some gaps in terms of a number of those institutions not applying to be registered. And there are a number of reasons for that. The agency within the ministry has explained concerns around enforcement, and the evidence of taking action to correct that is there in that new legislation is being crafted. What we have to do now is to advance that process so that the regulatory framework can be a lot firmer and the enforcement can take place.
On Monday, the opposition had questioned why a deal was inked with the Andrews Memorial Hospital to accommodate non-COVID patients of the Kingston Public Hospital before ascertaining whether they were registered or not. Dr. Maurice Guy labeled the move by the Health Ministry as a dereliction of duty. O'Shane Masters, TVJ News.
And with the number of COVID-19 cases inching closer to 500 in the island, the Health Ministry says focus will now be on making the tests for the virus more widely accessible. Health Minister Dr. Christopher Tufton was responding to a question about whether the government will be asking private facilities to do the tests for COVID-19.
Evidence of a more aggressive testing is there. We're close to 6,000 tests. Almost doubling the number of tests in a relatively short period of time. We're moving to another phase now, as was announced some time ago, where the antibody testing, another type of test, will eventually be introduced into the population. And the discussions are now taking place at the level of the ministry as it relates to how those tests would be administered. So I'm not going to commit one way or the other at this point in time. I will await advice from the technicians, the clinicians. But what I will commit to as the policymaker in this field is that we will ensure that the tests are more widely available so that the population can have access.
This will become a standard test eventually, and it is about, therefore, setting the standards as to how these tests can be applied. The ministry is presently doing that. And I'm sure in short order, you will see the standards being made public and the protocols for onboarding private partners will be ready, and I think in short order.
Students at the primary level will know which high school they will be attending before the end of June. Minister with responsibility for education, Carl Samuda, made the announcement last evening. Mr. Samuda said results from the primary exit profile PEP exams from grade 5 will be used for the assessment on placing current grade 6 students in high schools.
The placements will be released on June 26, 2020. We are already advanced in the preparation of those placements, but we have to make sure that they are properly checked and cross-checked and assessed.
Schools have been closed since March 13, with the expectation that they would reopen on June 1. Mr. Samuda said that planned reopening won't happen, adding that online teaching will continue up to July 3. Schools will not reopen until September 7 for the new school year. It's a position which have gained favor with President of the Jamaica Teachers Association, JTA Owen Speed.
In the main, they have gotten it right in terms of the reopening of school, setting a date for the reopening of school. And as we know, it is something that is tentative because everything depends on what COVID does. But we are happy so far that something decisive has come out. And the way they are treating with PEP, we are in agreement with that as well. And so we'll wait and see what happens as we move along.
In the meantime, he's still requesting some financial assistance from government for teachers who are engaged in online teaching.
We'd like the government, though, to put aside some type of a budget and to make it abundantly clear what it is that they are contributing to the whole continuation of virtual teaching and learning, because at this time, the teachers' funds are depleted, and I don't think that the teachers will be able to carry the virtual teaching, learning financially.
Now, as the number of COVID-19 cases in Jamaica balloons, one parish remains coronavirus-free. The residents and authorities in Hanover say it's the result of deliberate and coordinated efforts. Here's Herman Green with that report.
Up to news time, Hanover remains the only parish with no confirmed case of COVID-19. For residents like Tashana Blackwood, it's no coincidence.
One of the main factors that I think contributed for us not having any case so far is because of the efforts that we have made, Hanover has made overall in maintaining the environment. I've noticed while living here that the hospital here is much cleaner than anywhere else I've been so far. Also the infirmary. And the efforts that they put in overall the town and the environment. I'm not saying that this is all perfect.
It's a view shared by many, including the chairman of the Hanover Municipal Corporation, Sheridan Samuels. But more specifically, he believes taking action early was the key.
We actually started out from very early, because when the COVID virus came along, we actually, the CEO of our organization, Mr. David Gardner, called all staff together and have a discussion, have a meeting about the impact and the action to be taken.
That plan of action saw new measures which he says were implemented from the first week of March. That's before the health ministry announced the first imported case on March 10. The measures were for the markets.
I know that you must be fully aware now that we established the protocol where we have one entry in and one entry out. Persons entering the market have to wear a mask, they have to be hand sanitized, and they have to maintain the social distancing within our market itself. Persons who don't abide by that, we ask them to leave.
Also for the parish's health providers. The Hanover Medical Officer for Health, Dr. Kashal Singh, says all workers have been trained to handle suspected cases and are testing constantly.
Our hospital, our 5 health centers are can take samples, and they're taking samples for influenza-like illnesses and any suspected case of COVID-19. And those samples are sent to NPHL, National Public Health Lab. In those samples were tested.
The transport sector is another such collaboration. The Municipal Corporation chairman notes that this required particular focus as it channels hundreds of persons in and out of the parish daily.
The situation the other day with the St. Catherine persons coming into cell. But I must place a lot of emphasis on persons from outside, because we are really concerned about persons from outside that are working here.
In addition to regular hand sanitizing at every establishment, we were told that the bus park also does this thorough sanitization exercise with each trip. Herman Green, TVJ News.
And we now take a break on the midday news, but please stay with us. We'll be right back. Welcome back. Continuing the news now. The Transport Operators Development Sustainable Services, TODS, is calling for the Transport Minister to provide a waiver of fees for over 300 JUTC sub-franchise operators who are unable to pay due to the coronavirus pandemic. According to its president, Egerton Newman, this is needed as the public transport sector has been suffering without a fare increase for the last 8 years. He says that is compounded by the sector now being asked to transport fewer passengers due to COVID-19. It's why Mr. Newman is this afternoon urging the government to understand the plight of the sector. Minister without portfolio in the Ministry of National Security, Matthew Samuda, says the new Broughton Sunset Rehabilitation Centre is prepared to combat COVID-19 should it enter the Manchester-based facility. Mr. Samuda, alongside Commissioner of Corrections, retired Lieutenant Colonel Gary Rowe, and his team, conducted a tour of the facility over the weekend. Mr. Samuda said the purpose of the tour was to ensure that procedures put in place were being adhered to.
So this group is particularly vulnerable, so it is useful to come and see for yourself that temperature checks are being done, that the wash stations are in place, that masks are being worn by all staff, that the questionnaire that we've insisted at the entrance to all facilities is actually being used. Because as we've said time and time again, the vector won't appear, the virus rather won't appear here by accident. It will be brought in by either a visitor or by a guard. Now we've suspended visits, so it really only puts the responsibility on our warders to keep the virus out.
He explained that further dialogue with the Health Ministry is underway to ensure that protocols at the facility are in line with the standards outlined by the Health Ministry. Mr. Samuda said so far the Rehabilitation Centre has been following protocol.
At this stage, we now have a mask protocol for all staff in line with the Prime Minister's declaration under the most recent disaster order. We also have checked that the wash stations are in all facilities as they're supposed to be, and hand sanitizer has been properly distributed. We've also ensured that all points of entry for all of our facilities have the ability to do temperature checks. So, things are progressing, but more importantly, because we're out of the first phase when, the virus had just come to Jamaica, we've also planned to, should the worst visit us, and there indeed become someone infected in one of our facilities, and all facilities have their isolation space.
To some non-coronavirus related news now. Investigators believe skeleton remains found yesterday in Discovery Bay, St. Anne are those of a woman who went missing 7 months ago in the parish. The remains were discovered about 8 a.m. while persons were hunting for crab along Dairy Road. The remains are believed to be that of 28-year-old Shanae Reed, a waitress of Queen Heights District. The police and family members were alerted, and during a search, items of clothing which belonged to her were found. The remains were removed to a funeral home for DNA testing. Ms. Reed was reported missing on October 19 last year after leaving work and didn't return home. A search was carried out, but she was not found. News overseas now. The World Health Organization has warned that more early cases of coronavirus are likely to be uncovered in countries around the globe. It comes after a French doctor said he had tested a sample from a patient diagnosed with pneumonia on December 27 last year and found it was positive for coronavirus. The development means COVID-19 may have arrived in Europe almost a month earlier than previously thought. Speaking in Geneva, a WHO spokesperson said he was not surprised by the news. He called for other countries to reassess their medical records from late 2019 to help build a newer and clearer picture of the pandemic. Still overseas, a revised model from the Institute for Health Metrics and Evaluation at the University of Washington in the United States shows a near doubling of its previous prediction of U.S. COVID-19 deaths by August to 134,000. This comes as more states take steps towards reopening their economies. More from the CNN.
The United States facing a double-edged sword.
There's no way to sugarcoat it. If we don't open up the economy, we can feel the pressure. If we do open it up, we will feel the pain.
The social distancing since the coronavirus pandemic broke out caused unemployment in the U.S. to skyrocket, and companies of all sizes are feeling the pinch. Gold's Gym and J. Crew have filed for bankruptcy protection, while United Airlines is telling workers to seriously consider leaving voluntarily. Medical officials say easing restrictions will cause the disease to spread more rapidly.
When you have mitigation that's containing something, and unless it's down in the right direction and you pull back prematurely, you're going to get a rebound of cases.
But some say keeping the restrictions also poses a threat.
We've got to let some of these folks get back to work, because if we don't, we're going to destroy the American way of life in these families.
That's why officials and leaders are trying to reach a balance.
There are regions, areas, counties, cities in which you can do that safely now. But there are others that if you do that, it's really dangerous. And that's the thing you've got to be careful of.
Time now for sports. Stakeholders at Caymanas Park have given Supreme Ventures Racing and Entertainment Limited until Friday to reverse its decision to scale down the number of days that the track will remain open for training due to COVID-19 measures. Denise Walters reports.
The exercise regime cut from 4 days to 3 days and to 2 days is a death sentence for horses.
That's champion trainer Anthony Nunez speaking to TVJ Sports after a stakeholders meeting at Caymanas Park on Monday. After Saturday's fiery protest at the Meadowville entrance of Caymanas Park, stakeholders called a meeting to discuss SVRL's implementation of several new measures, including the cutting of staff, reduction of salaries, and a scaling down of training operation.
Even if you said to us in July, all right, start back work, it takes these horses about 12 to 16 weeks from ground zero, back up to a fitness level that they can race. So you're talking about September. That will cripple the industry.
Ryan Darby, president of the United Racehorse Trainers Association, agrees with Nunez.
As soon as the Betting Galaxy Commission and the Racing Commission, I know the platform for us to work with, we need to be in a position to be ready within a reasonable time, because horses cannot be left in the stall and then take out the race.
Trainers Gary Sabrati and Stephen Todd say reducing training to 4 days this week, 3 days next week, and 2 days the week of May 25 will not cut cost.
Supreme Ventures has said that they're spending in about $38 million a month to keep the track going. The stakeholders are spending about $60 million, so we are collectively spending more money than Supreme Ventures.
To maintain this track, the racetrack itself, if you don't water it and maintain it, the sun is going to blow off. So it's going to cost them millions more to put it back. So they have no intention of taking care of poor people down here.
General Manager of Racetrack Operations Anthony Shakir, who previously served as chairman of the Jamaica Racing Commission JRC, says SVRL has to be solution driven.
You cannot hold an industry that supports over 30,000 people to ransom. You're not going to win. You're not going to win.
Meanwhile, jockey Prince Holder, who was injured in a nasty spill riding struck by Grace in a race where 2 other jockeys fell on December 26, 2019, says something has to give.
Although the COVID are going, you need to make a race run. I know say the punters them know them for work towards the social distance, buy them bed, go home and just watch racing on TV. I know say we have a food for get, that's where everybody can eat, because everybody hungry right now. And I'm not now go on there to make my mother again.
TVJ Sports has learned that the Danville Walker chaired a project monitoring committee appointed by the government to observe SVRL met on Monday and should announce a decision in the coming days. Denise Walters for TVJ Sports.
And that's the Midday News. I'm Vashon Brown. Join us at 7 for Primetime News Package. On behalf of the news, sports and production teams, have a good afternoon and have a great day.